and
Hi,
Dr.
James Escaloni here.
And we are presenting the 50 Shades of Pain show. When it comes to pain, modern medicine has become a money machine designed to turn its suffering patients into lifelong customers. I'm Dr. Donish, a native Kentuckian and the visionary behind Wellward Regenerative Medicine. As a Johns Hopkins trained, double board certified anesthesiologist and regenerative pain specialist, I believe it's time to bring true healthcare back into medicine and offer you, the patient, the healing you deserve. This 50 Shades of Pain show is one way we empower you, the patient, to receive sustainable treatments for injury and pain without surgery, addictive medications, and without being a victim of the system designed to work against your healing. So, I welcome you to start your healing journey at wellwardmed.com, our website. Today, I'm with Dr. Escaloni, who serves as a physical therapist but also as a physician extender here at Wellward. Like myself, he's seen firsthand countless lives who have unnecessarily, not for lack of qualified or caring doctors, suffered unnecessarily, but rather they've suffered unnecessarily due to the broken healthcare system that we at Wellward would like to help fix. So, Dr. Escaloni, what are we talking about today?
We're going to be talking about something called lumbar spinal stenosis. This is a big deal. So, how you can think about it is this. Have you or a loved one had to walk in a cart, holding onto the cart at the shopping market because you couldn't stand up straight? Your legs hurt too much. Or maybe the more you started to walk, trying to walk, get healthy, it's springtime, trying to get outside, get some sun, and your legs felt heavy and weak, and the longer you walked, the worse it got. Have you noticed that only sitting down can seem to make those leg symptoms start to get better? Or if you noticed, if you tried to stretch your back backwards, it really hurt your back and legs. Well, you might have spinal stenosis, and this is about that show, and it's all about you today.
Yeah, lumbar spinal stenosis, it's a really common problem. It's kind of the end point of having degenerative back or degenerative injuries to your spine that culminate in that stenosis developing. And essentially, it's what happens. Let's talk about the spine itself. So here's a spine. Over time, what happens to all of us is just as how our face develops wrinkles, we develop essentially wrinkles in the inside. The ligaments of our body start to lose their integrity, and rather than holding bones together like this, you start to get a little bit of wiggle going on. And initially your body compensates that wiggle. So if you can imagine like a spine, if you've got a little bit of wiggle going on, particularly in the low part of your spine and in the low part of your neck, like in this area, I'm doing this backwards, or in this area, those are oftentimes spots where that wiggle becomes really problematic, because the loads that are on that part of the spine are transitioning from one direction to another direction, and if there's not ligamentous support at that segment, then you can get that wiggle back and forth. A lot of times the first thing that people do in that situation, they'll start to feel some pain, and physical therapy is really incredibly important at that stage, because what physical therapy will do is it'll help to hone the muscles, strengthen the muscles that give backup support to those ligaments, so that that wiggle doesn't take place as much as it's doing. James, what kind of things are done at that stage for the physical therapy?
If you've got a good physical therapist, what they're going to be doing is they're going to be trying to get these smaller muscles in your back especially to start to kick in. These ones that are right here, they are like a big V but upside down. They go from this bony spot to these other bony spots out to the side. They're called the multifidus. That multifidus, what it's going to be doing is if you can get this strong and have a lot of good proprioception, it will help back up all these ligaments that are right here. This will stop it from moving back and forth. Now, a cool thing about the muscles is that can contract a little bit or a lot depending on how much extra motion is going on there. That's one of the first things your physical therapist should be doing. Additionally, they should be trying to get your own internal weight belt You ever seen those guys on World's Strongest Man lift those heavy things above their head? They get those big girdle belts on there. Well, it's to extra support what you already have in there, your big oblique muscles. If you can get those big oblique muscles, yeah, there's the multifidus.
Right there, that's the multifidus. And then this here is the oblique muscles.
They're like your side abs, but they go all the way around, your own internal weight belt.
Yeah.
If your physical therapist is worth his salt, then they're going to be getting it so that those muscles are starting to wake up and start to challenge them, so this can prevent a little bit of extra motion. And then if you've got some stiffer hips, well, down here you can't see because there's no pelvis on this guy right here, but if you can get those hips to move well and keep the buttocks strong and keep good balance, then you're going to be further taking pressure off of here and taking on the load through the biggest muscles in the body, the muscles in the hip. You get that done early on, you're having a good chance that this might not progress too much.
Right. So spinal, that's the best way you can prevent spinal stenosis, is by either strengthening the muscles of the back to provide some backup support to the ligaments that are failing, or some of the regenerative therapies that will help stabilize these ligaments and prevent them from losing their stability, and prevent them from evolving into this degenerative spine. When that doesn't happen, if they don't get the proper physical therapy, or you don't get the proper regenerative strategy that helps to fortify those ligaments, the stress starts to put a lot of tension on these discs. And discs are really good at compressive forces, but they're really bad at shear forces. They don't handle side-to-side motions. The whole spine is designed to stabilize this disc from sliding forward and back. So you can imagine all of this weight on the trunk down on one or two segments, and it's very understandable why people start to get degenerative discs if they don't have the proper backup support to those discs. Now, if that goes on for long enough, what ends up happening is that everything in the spine starts to thicken and harden. So what's not shown on this bone model are the ligaments that run in between here, the ligaments that surround the joint capsules, the ligaments that run up and down on the sides, and the ones that kind of anchor the whole spine to the pelvis back here. All those ligaments are not shown, but what happens is that those ligaments will start to thicken and harden and almost become like bone. So when you look inside of this spinal canal, if we were to look inside of here, what would happen is that open space in there that you're seeing, that would start to thicken and start to compress in on the spinal cord, as well as the nerve roots that are exiting out the sides. And that's essentially what's called spinal stenosis. A lot of people historically have thought that spinal stenosis is a problem with nerve being compressed, but it doesn't make sense. The symptoms don't really make sense with that. So a more modern thought process behind it is, it's not so much that the nerves are being squished as much as it is that the reduction in circulation is what's causing that achy type of pain. A really good example is, James, have you had your blood pressure taken?
Oh, yes.
And what does your arm feel like when that cuff is inflated?
It feels pretty bad.
Yeah, it feels pretty achy. It feels like there's just a lot of pressure in your arm. And that's just from blocking the circulation to everything from your arm down. So you can imagine, if we were to block the circulation in the spine, everything on the path of that nerve would have that same feeling. It would feel like a tightness, a compression, an increasing achiness that gets worse the longer you stand, because the longer you stand, the more the blood pools in your spine and starts to squish in and compress things. And
nerves don't like to be compressed, do they?
They don't. I mean, another really good example is just hit your funny bone. You get a zing of pain to it, but you also get some pain if you just let your arm rest on something with your elbow flexed, putting a lot of pressure on that inside part. It just progressively builds and gets to the point where your hands feel tingly and numb. So spinal stenosis is a really common problem and typically the end product of a lot of issues that could be prevented. If we can see people before, early on in their pain problems, a lot of times we can do things that will prevent that from evolving into a spinal stenosis problem. But if we miss that boat, if we miss that opportunity, there's fortunately some newer techniques or newer breakthroughs to help people with stenosis.
Or do you mean like spinal fusion?
Yeah, great question. So kind of a it's a loaded question. The most common response to spinal stenosis is to have a surgery called a lumbar laminectomy, where they actually remove this bone right here to open up the space inside of here. But the problem with that is there's a purpose and a utility to every single one of these bones. James, can you explain from a physical therapist standpoint, what value do these spinous processes have in the body?
Well, they're going to be every single spot where a muscle attaches to help move a bone. This guy can't say dope like this unless he has all these muscles moving, and those muscles attach to all those spinous processes so that they can get some muscles to move the bones. And it's also underneath each one of those where the ligaments attach to help support that. So it can either promote or prevent motion in every part of your body.
Yeah, so I'm going to show this again. That's the spine model, or the muscles. I've taken away half the muscles on one side. But if I take away all of the muscles, you can see the red and blue dots are everywhere that the muscles attach to the bone. And if we were to get rid of that bone, those muscles don't have an anchor site anymore. So that segment no longer has the backup support that we talked about as being so important, where if the ligaments are failing, your backup support are the muscles. And if we cut away the bone to open up that space and get more breathing room within the spinal canal, but in return, we're destabilizing that segment by taking away that bone, then the only other option a surgeon would have is to fuse those segments. And while it can be very helpful in a worst case scenario, it's becoming increasingly unnecessary because there's so many ways we can stabilize the spine without needing to cut away that bone, and so many ways that we can debulk or open that space up now without having to do surgery where we cut the muscles, we cut away the bone, we expose that area and create a ton of scar tissue in the process. And that's where this new procedure called the mild procedure comes in. I'm going to let James explain that. I'm going to grab a brochure to explain it since I forgot to bring that.
So when you guys think about this, we are trying to figure out a way so we can bring blood into the rest of the body, into the legs, at that spinal level that's had some compression. So what a surgeon will often do with a fusion is they're going to take these huge rods invasively in there to poke you up there. Now that is a huge surgery with a whole lot of consequences. Mild stands for minimally invasive lumbar decompression. So instead of taking a rod like this big to put into this area here, we're going to be taking a smaller object that he's going to describe that he can move almost like a key to push, twist, and then lift it up a little. It makes the hole so small, afterwards you can barely see it. And the results are absolutely phenomenal.
Yeah, so to give you a better visual of that, when we're talking about the ligaments thickening in the body, what we're talking about is this one is normal, where you see that purple is essentially the spinal canal. The green is the ligament. So to give you a better explanation, if I were to cut this skeleton down the center like this, and then look in from the side view, that's what I'm seeing with this. These are the discs right here, going backwards there. That's a disc, this is the bone. The joints would be back in this direction, and then this is the spinal canal with that thickening ligament. That's the ligamentum flavum. That's what causes that stenosis problem, or rather one of the two main issues, because if you imagine this as a ring, where on the front side is the disc, like on this side is the disc, on this side are the joints. When you're dealing with stenosis, you're dealing with problems from both ends because the disc has lost its integrity over time, so it's crushing. And then the ligaments on underneath the joint here are also thickening, so you're kind of getting this appearance. And you'll see on the next picture, let me see if I have a good picture of that. Right, so on this picture, you can see this would be a normal spine. This would be the stenotic spine. So you can see the disc from one end is squishing in, and these ligaments from the other end are squishing in. And what a surgical approach would be to cut here and cut here, right there, to open up that space and remove this bone, so we can give some more breathing room to this area. But what the mild procedure does is, I put in a straw under X-ray right here. We go in right here with this tiny little straw, and then through that straw, I can shave away this ligament without really affecting any of the other structures around it, any of the muscles or the bones, and just provide a greater amount of breathing room. So converting this back to something closer to this, where now circulation can get into that spinal canal and allow circulation to move more freely and give that body some breathing room. So, the typical patient with spinal stenosis, you see them walking stiff postured, kind of bent over like that. And if you ask them to stand up straight, they really can't, because it's not just that worsens the stenosis, but it's actually mechanically restricted in some people who've been in that posture for such a long period of time. Now, the mild itself will open up the stenosis, and people feel remarkably better. I mean, massive improvements. People will come in unable to walk, and after we're done, aside from the soreness that results from the initial part of the surgery, they're pretty much walking back out the door and going home, as opposed to a surgery which can take months and months to rehabilitate. People feel back to normal within a few days, and they feel better than normal within a couple of weeks. So it has really been a remarkable change.
I've seen people on follow-up, and I almost don't recognize them, almost because I've been looking at the top of their head for so long, and now I'm looking them straight in the eyes since they're walking upright. And it's such a simple recovery time, too. I was actually amazed when I started to learn about this process, and I'm still more and more impressed to see that out of all these areas where people have pain, they only had this one little spot that just needed a mild procedure that could have helped them out. But it takes a long time and a lot of work to be able to figure that out, and not all physician offices are ready to do that amount of work.
Yeah, and the other part of this is that there are other doctors that are doing this, but they're not combining it with some of the regenerative strategies that we have, because the things that led to the spinal stenosis from happening are not fixed with the mild. We're only fixing the downstream effect. But to really have a good sustainable effect, then we need to work back upstream to the problems that caused the stenosis to happen in the first place, which is that segmental instability, that shifting back and forth, and the stability from the muscles and ligaments on the backside, as well as the disc itself. And for that, there are some more advanced strategies that we'll talk about in future visits or future episodes. But what I always tell patients is that the mild is going to give us a big boost forward, but there's still going to be some work that we need to do on the rehabilitative side and potentially some of the regenerative things to help fortify it and prevent it from coming back. Because Medicare will cover this service even on an annual basis, but I'll be honest, I've only done that, I've only had to repeat it on a handful of patients, and that was only because we weren't able to get the stability that we wanted to get without going to a more advanced technique.
This has been really an amazing lifesaver for a lot of physical therapists I know, because they work their butt off for their patients. They care so much about the people in front of them, and they're working with them day in, day out, suffering with you, and they feel like they're stuck just like you feel stuck. Then a patient finally comes gets the mild procedure done, they can return to their physical therapy, and oh my gosh, that physical therapist is ecstatic because they can finally give that person the care and help that they wanted to give them this whole time, as they get them back to being able to go on those trips, being able to play with their grandkids, even go out for hikes like they wanted to again. It's amazing.
Yeah, I always tell patients, what is it that you are not able to do because of your pain? And who is the identity that you identify with or associate yourself with? Like the vision that you have of yourself, that idealized version of yourself is a really, really important tool. And if you feel like you're not reaching that idealized version of yourself, or you have a pain issue that's hindering you from being that person that you want to be, then come see us. We really need to talk, because one of the most key things that we do here at Wellward is we want to help you realign yourself, your reality, with the envisioned person that you wish to be. And when you're dealing with spinal stenosis, I know that that's somebody who has dealt with this for years and years and years before they get to this point. So they have in some ways reshaped who they are, their entire identity, around the existence of that pain. And it doesn't need to be that way. People don't need to live that way, and what we want to do is help people live the lives that they're meant to live. So if you're a physical therapist who sees a patient dealing with spinal stenosis, surgery is not the only option. If you're a patient who has dealt with spinal stenosis, you are long overdue to be seen by us. If you're a provider or a clinician who sees this in your patients, by all means have a conversation with us, because there are a lot of opportunities to help people in very meaningful ways without going to drastic needs like surgery or lifelong medications, or just sucking it up and dealing with it. That's not always necessary.
Mm-hmm.
So we would love to invite people to have deeper conversations with us online about this. We'd love you to join our email listserv. We send out content and blogs on a regular basis. If you'd like to join, just go to our website, wellwardmed.com, and sign up. If you do sign up, we'll give you I wrote a book a couple years ago, 50 Shades of Pain, hence the title of this show. And if you sign up on our website, we'll give you a chapter of the book that I think everybody really does need to know. And that's the top 5 questions everybody should ask their physician about their pain issue. You can get the book on Amazon. It's only $1. We've priced it that way because it's really our public service to try to educate as many people as we can around better ways of treating pain rather than the standard conventional approach. We thank everybody for watching this show. The 50 Shades of Pain show is a new enterprise for our practice. It's an endeavor that's really supported by the community. So we appreciate everybody who comes on and watches. Every patient is very different to us, and there are numerous factors that can contribute to your pain. In the same way, we recognize each patient as individuals and create treatment plans designed specifically for your health. Our Wellward team looks forward to partnering with you. I'm Dr. Danish.
I'm Dr. Escaloni.
And we encourage you to start your healing journey at wellwardmed.com. Thank you. Jinx.